Okay, then we switch to the next talk. Dr. Michael Horstmann is going to talk about not yet realized nanoapplications for the transdermal route. So you see we are switching routes because it has a lot of relevance for the performance as a drug.
Ladies and gentlemen, am I here? Yes. I thank the organizers for inviting me. Beat Löffler was here? Yeah, maybe, yes. And for the great part of the organization they take here. Also to Bernd Riebsel for this introduction. And the topic of my talk seems to switch well behind the preceding ones, despite the topic seems to be a little bit strange. Not yet realized nanoapplications for the transdermal route. I will split it into three sections behind the introduction. The nanoscale supersaturation topic, the state of belief, I called it, in dermal nanoparticle absorption. This is still a question of belief. Some are believers, some are not. But it's a question, are nanoparticles really absorbable on a large extent via the skin? And the last point is microneedles as vectors. These are three quite separated topics, and I need some concentration for this. This is the diagram that was used by Berners and Cooper several years ago because they formed a correlation between melting point and the properties of a compound and the achievable drug substance flux in skin. And still, I did nothing else than to fill in the properties of registered compounds in the market, and you still did their rough, because it's by logarithmical, rough correlation is still valid. But we are here in matters of nanotechnology, and nanotechnology means we have to take care on the size of particles. And the particles that pass the skin, if we think of molecules, are lower than 1 nanometer. Fullerenes have about a nanometer in size, and lower particles have lower. And if they have to pass the multiple skin lipid layers, we see here a single lipid molecule on their pathway, then it's already a molecule, and we do not take the nanoparticle issue. The nanoparticle issue is starting with 10 nanometers and more, in fact, and then we have 1 million of Daltons. I raise this point because that makes the difference between being absorbable on this level with a molecular weight of 100, 300 or 1000, maybe here, and the knowledge that between this and this there is an absolute limit for absorption because particles are particles, and we have no pinocytosis on skin. We have tight junctions, very tight junctions, because we have a several layer thick stratum corneum. We have only very limited excess of hair, bulbs and things like that. So in my eyes, all publications about absorption of nanoparticles via the unchanged skin are a little bit strange and require some careful review. Generating flux increased by freezing nanoparticles into sugar-like polymeric hydrophilic particles is, however, something more vivid, because this is in conjunction with the two colleagues that presented before. if you nanomill particles and conserve them by addition into hydrophilic environment, we may conserve their solubility because they will not recrystallize, in some cases at least, if they are lipophilic, like transdermal candidates are. And we can distribute then the particles in a formulation which is lipophilic again. Nothing happens during stability normally. And after having placed on the skin, at the time of use, the particles swell and dissolve, and then we can get the real boost. This is a nice idea, but it's patented by a company, and I have no access to this invention, just to complete the information a little bit. But nothing is without circumvention possibilities. Nanoparticle absorption through unchanged skin is unlikely, but not fully excluded due to the stratum corneum areas around the hair shaft follicles. There are some areas of the skin that look like being candidates for slight absorption. I will not discuss this too much. Maybe altered by easy entering of a certain size fraction between 400 and 800 nanometers, according to Dr. Lademan. Professor Lademan told us that these particles enter follicles and may last there for longer. That does not mean that they are absorbed, they just last longer. And we may happen to ease the distribution into the skin by solubility enhancement and by carrier effects, and in the worst case by the powder jack transport. This is a machine gun which transports powder into the skin, however, not nanocrystals, just big crystals, otherwise they would not pass. So it looks not very good, but co-precipitation, the absorption of nanoscale titanium dioxide is negligible according to Lademan, but co-precipitation of degradable nanoparticles with APIs may lead to increased absorption, but this without a direct link to nanoscale influence, because this is a normal solubility behavior and has nothing directly to do with the size of the product. This is needle-assisted delivery. Needle-assisted delivery sounds strange, but these are microneedles. They are not long. They are 200 or 300 micrometers long. They will not give you the feeling of a pain. You have corneocytes in the skin, in the stratum corneum, that are pierced. And insofar, this is an opening possibility for nanoparticles. However, only to a very high level still of the skin, but without torture. Without torture, but not necessarily very clean. If we discuss microneedles, we think about cleanliness, and I take purposefully this opuntia, which is a dirty fact, an extremely dirty one. But I show you later the results of the use of this nice equipment and nice microneedle array example of the nature. We compare a little bit the sizes. This is the Glochidia hair structure with the counter anchors here, so they stick in the skin and they stay in the skin. They are even worse than what we ever produce. And this is a very similar shaped silicon microneedle I use normally in my experiments. And this is the needle of a sewing needle. So you see that there is a very thick tip compared to the opuntia, and in the right size also to the silicone needle. They all have a rounding radius of around 1 micrometer. Not much more, not much less. And this is sufficient with a very low power to fill into the skin without resistance. And this looks like when you have the microneedles in your skin, and this hurts a little bit. But it hurts only because they are too long. They are not only 200 micrometers long, they are longer. And they are freestanding, and that hurts. We have here something different. We need, however, something that repeats the movement of the microneedles. Otherwise, we can never apply nanosuspensions. We could apply nanosuspensions after being punched with microneedle arrays. We could, but this is static, and the opened ways do no longer stay open. They start to close after about 6 to 10 hours. Okay. And if we do it this way, we keep at the same fashion this suspension into the skin, and we keep also the you see that this suspension is opened and some particles go into the skin. I repeat it again, because this is still theory and not practice. Just the idea of the nanosuspension application with a nice tool, which is this microneedle array, activated by a piezoelectric web material, a trafo, a frequency generator, and a battery. This sounds big, but it's not. It's in principle very easily miniaturizable. We have here the array, here the foil which is active. Here this tool is a little bit bigger, but we can still use it outside the body. And we should not think that this all is new. It is old science, because Baunscheidt already did tell us all this secret 150 years and more than that ago. So we should stay on this fact. I would like to have shown you some photographs, but the time is not sufficient, and I didn't get in my possession. The photographs didn't get in my possession. That was the first in vitro showings of that. This work is going on, and I hope that I opened a little bit your eyes for some nanotechnology applications. Thank you.
Okay, thank you very much. Thank you. Do we have questions on the floor? No? Yeah?
Very nice lecture. So there are possibilities with these needles. I know, a little experience, they are also doing tattooing. What's the difference?
The tattooing has to go into deeper structures, so it's always painful. The pigments need to go under the...
So the needle, it's longer?
Under the cambium, the stratum germinativum, which is about, my thinking is 400 micrometers deep. So you have well go beyond and to stay the particles and pigments there.